Hello everyone, my name is Haniesya Qistina Binti Hubry and my metric number is BM25110029 and I will be presenting my special study module which is on the liver. So the liver is the largest internal organ and one of the most vital organs in the human body. Although it often works silently, it plays a central role in maintaining homeostasis, and understanding it is important because its dysfunction can affect multiple body systems and can lead to life-threatening conditions. So on this special study module, we will be focusing on six parts, which is the anatomy of liver, the function of liver, the biochemistry of liver, the pathology, and the technology to diagnose liver disease, as well as the hepatologist, which is the specialist in the field. So to start with, let's look at the anatomy of liver. The liver is located in the right upper quadrant of the abdomen beneath the diaphragm, and it is protected by the rib cage. It is reddish brown, soft, and highly vascular. Anatomically, the liver is divided into right and left lobe by the falciform ligament, along with two additional lobes, which is the caudate and quadrate lobe that is visible on the visceral surface. The liver also has two main surfaces, which is the diaphragmatic surface, which is smooth and convex, as well as the visceral surface, which is concave and related to surrounding organs, such as the stomach, duodenum, and the right kidney. One of the key anatomical features is the porta hepatis, and it is where the portal vein, hepatic artery, and bile ducts enter and leave the liver. The liver also has dual blood supply, about 80% of the portal vein and 20% from the hepatic artery. And this unique feature will allow the liver to process nutrient-rich blood while also receiving sufficient oxygen. Microscopically, the functional unit of liver is called hepatic globule, which enable efficient exchange between blood and hepatocyte. Now, let's move on to the function of liver. Physiologically, the liver is important for maintaining homeostasis. It plays a major role in metabolism, digestion, storage, and immunity. In digestion, the liver produces bile, which is necessary for emulsification and absorption of fats. In metabolism, the liver regulates blood glucose level through glycogenesis, glycogenolysis, and also gluconeogenesis. It also metabolizes protein by converting toxic ammonia into urea and synthesize important plasma proteins such as albumin and other clothing factors. Additionally, the liver stores glycogen, iron, and fat-soluble vitamins such as vitamin A and D. Immune function is also carried out by Kupffer cell, which remove bacteria and toxins from portal blood, and also protect body from infection. Now, let's move on to the biochemistry of the liver. So from a biochemical perspective, the liver is the main site of drug and toxin metabolism, and this occurs to phase 1 and phase 2 reaction that mainly involve the cytochrome P450 enzyme system. And this reaction converts harmful substances into water-soluble forms for excretion. The liver enzymes such as ALT and AST are also involved and is released into bloodstream when hepatocytes are damaged, while ALP and GGT will indicate bile duct obstruction. And these enzymes are essential as diagnostic markers in clinical practice. The liver also plays a crucial role in bilirubin metabolism. So unconjugated bilirubin from red blood cell breakdown is taken up by hepatocyte and it is then conjugated and excreted into bile. This disruption of process would lead to jaundice, which is a common sign of liver disease. So now let's move on to the pathology aspect of liver. One of the most important liver pathology is cirrhosis, which results from a chronic liver injury. It is characterized by fibrosis, regenerative nodules, and also distorted vascular architecture. Cirrhosis often develops silently, and many patients remain asymptomatic until advanced stages. As liver architecture is destroyed, complications such as portal hypertension, ascites, hepatic encephalopathy, and also hepatocellular carcinoma may occur, and this would highlight the importance of early detection and prevention of chronic liver disease. Now, let's move on to the technology that is used to diagnose liver disease. As we all know, modern technology has improved the diagnosis of liver disease. Elastography is a non-invasive imaging technique that measures liver stiffness that often correlates with fibrosis, which is one of the symptoms and clinical features of liver cirrhosis. It is done based on the tissue response on the mechanical and shear wave, and this elastography will allow clinicians to assess liver fibrosis without having the need to do a biopsy. Elastography is also painless, useful, and quick for monitoring disease progression, although results can be affected by factors such as inflammation and obesity. Finally, we are moving on to the specialist in the field, which is a hepatologist. So, a hepatologist is a medical specialist who diagnose and manage liver and biliary diseases, including hepatitis, cirrhosis, and liver cancer. Hepatologists play a crucial role in early diagnosis, also monitoring the diseases and liver transplantation care. One of the most influential figures in hepatology is Hans Popper, and he is known as the father of modern hepatology. He has revolutionized liver medicine by correlating clinical findings with histopathology and also establishing liver biopsy as a key diagnostic tool. His work laid the foundation for modern understanding of fibrosis and cirrhosis, as well as hepatitis and also fatty liver disease. In conclusion, the liver is a highly integrated and multifunctional organ that is important for survival. Understanding its anatomy, physiology, biochemistry, pathology, and modern diagnostic tool will allow for better prevention, early detection, and management of liver diseases. Advances in hepatology will continue to improve patient's outcome and highlight the importance of this organ in medicine. That's all from me. Thank you for listening to my special study module presentation. Thank you.